Everyone's lives are affected by trauma in some way, either directly or indirectly. So no matter where they enter Terry Reilly, be it medical, dental, pharmacy, or behavioral health care, we have a trauma-informed lens in how we care for them.
Well, trauma is everything. I mean, trauma affects everything. It affects how we parent, our partnerships, our friendships, even how we are with our coworkers. And unresolved trauma affects our ability to protect ourselves and protect our loved ones.
When we're talking about health and the physical health of a person, research strongly supports that if a person has unresolved trauma, their life expectancy and lifespan is diminished. We know that the psychological effects and scarring on people oftentimes leads to coping strategies that don't work or do damage. And so understanding health, which is our organizational concept and directive, we would have to look at this element, because without it, we're doing disservice to the clients. My role is a little bit unique. We're a restorative justice program, so typically what we are doing is working with people who create events that are abusive in nature and can create trauma. Work with people who've committed sexual battery or sexual assaults, sexual abuse of some sort, as well as domestic battery and abuse. I would say what sets Terry Reilly apart is a organizational, from top down focus on the wholeness of the client that we work with. It doesn't matter what you've done, it doesn't matter what you do, what you're looking for help with. We're going to do what we can to try to truly understand who you are and help fill those spaces that you need help with.
Terry Reilly also provides complete healthcare services for people in shelters and Boise's permanent supportive housing initiatives, including New Path Housing, where the impact of trauma can be part of daily life.
I work with a lot of people who are unhoused, and I think one way that Terry Reilly addresses trauma is in taking, a special interest and care with people who have been experiencing homelessness. When we can help people get into housing and then help support them to maintain housing, we're helping them have that safe place and that refuge.
The constant exposure to vicarious trauma and compassion fatigue are challenging for therapists, so Terry Reilly emphasizes self-care and resilience building for its team.
I think we're really good at Terry Reilly about making sure that people are taking care of themselves. We want them to prioritize their own health.
It's really important for my team and myself to have a place to debrief and get feedback and guidance, and also just to be able to acknowledge that slow progress and improvements is still improvement.
And that slow progress over time reminds us that from dark places, there is still room for hope.
I work with these people directly, but my impact is on their kids, their friends, their family, their spouses, and the effect that their behavior has on them. And whatever I can do to help make their lives better, in the grand scheme, it is win-win-win.